Paul. It is a wonderful day with seeing all these smiling faces today on this rainy day. I am Dr. Kritika Upadhyay and I am the Program Coordinator for the International Public Health Management Development Program, and under its banner we are hosting the 6th Public Health Policy and Management Program. So it is a huge privilege for the Department of Community Medicine and School of Public Health at the Postgraduate Institute of Medical Education and Research, Chandigarh, for hosting this 6th program in the series of Public Health Policy and Management Program. On behalf of PGIMER Chandigarh, I extend a heartfelt welcome to 43 healthcare professionals who have joined us today for this beautiful program. And in these 5 days program, we will be looking after how the policy is going to develop, how it is implemented, and how a policy will be analyzed. Along with that, we are going to experience different kind of mix of pedagogy. A very special warm welcome to our program director, Professor Sonu Goyal, under whose vision and leadership we are continuing this program, and so far we have trained 1,500 professionals and more than 30 programs. So in this coming week, we will be reaching to the core of public health, understand the policy in its truest form, and along with that we are going to put you through lot of discussions, case studies, some role plays. Along with that, the spice is added through the gamification concept. So this program is not only an academic endeavor, but also an opportunity to build the bridges of understanding and solidarity. So we are really thankful to the Indian Technical and Economic Corporation for giving us this opportunity to host this program. So now it's time for a lamp lighting ceremony. I request our program director to kindly come on the stage, and I also request few of the participants to join Professor Sonu.
One from each region can come, one from South America, one from African region, one from Asian region, and one from Mediterranean region. Right, anyone, like, please join. Okay, wonderful. Come.
So participants, it's the time to witness the auspicious lamp lighting ceremony, a cherished tradition which symbolizes the transition from darkness to the illumination of knowledge and vision. Embodies divinity, wisdom, intellect, and pursuit of good deeds. Lighting the lamp signifies a beacon of hope, dispelling ignorance and inviting positive energy to guide us in overcoming negativity in our lives.
You can look here. One can come here. Thank you very much.
Thank you, everybody. So now we'll be going ahead with the program overview, and I'll be inviting Professor Sonu Goyal. He's a medical doctor with MD in community medicine with more than 25 years of experience, with various fellowships and an alumnus of Johns Hopkins School of Public Health, Baltimore, US, and Maastricht University, the Netherlands. He was also awarded the Public Health Excellence Award by the Honorable Union Minister of Health and Family Welfare in 2014. He holds the position of Adjunct Clinical Associate at the University of Limerick and Honorary Professor, Swansea University, UK. Along with the Director of ITEC MDP, he is Director of a Resource Center for Tobacco Control, which is one of its kind center in our country. E-Learning for Public Health, which is an online platform for teaching the millions of students, and then International Public Health Management Program, which you are already a participant of, and he was also a former chair at the Tobacco Control Section, the Union. So it's my huge honor to welcome Professor Sonu to the stage and welcome our audience.
So very good morning to all of you. As Kritika has said, it's a very pleasant morning. We are experiencing a lot of rains here in Chandigarh. So we heartily welcome you all participants from 28 countries, 43 participants to this 6th Public Health Policy and Management Program. Just to tell you about the legacy of this program has been a flagship program of Government of India and the only institute in the country which conducts the program for medical doctors and medical professionals. There are a lot of ITEC programs, but this program stands alone in the sense that we have been conducting this program for last now 10 years, trained 1,500 plus people from 90 plus countries. So it's a distinct honor to be with you all, participants from 4 continents who have come across spending their time in travel away from your families. Chandigarh being a very beautiful place, and you might have Googled before coming here that Chandigarh is known as the city of gardens. Chandigarh is also known as City Beautiful, and it was built by the French architect Le Corbusier. So Le Corbusier, French architect, built this Chandigarh, and you will not find many high-rise buildings here. It's a very quiet, peaceful, clean city, and it has been normally rated as number 1, number 2, or number 3 city in the entire country in terms of cleanliness, in terms of peacefulness. And our symbol of Chandigarh is Open Hand Monument. We will be going there. It's a heritage place, and it has found its place in the heritage book in terms of open hand. So its open hand represent that we welcome all. So it is about welcoming all without any discrimination to caste, gender, race. So we have that culture and tradition of having people from across the world without any discrimination. About PGI, the institute from where I belong. So Postgraduate Institute of Medical Education and Research, normally known as PGIMER, Chandigarh. So is again the number 1 or number 2nd. Sometimes it is number 1, sometimes it is number 2nd institute among 750 institutes in the country. So this rating, the global rating, has been there in terms of research, academics, and collaborations. So we are in many disciplines, considering you may say surgery, eye, any discipline you take, our hospitals are the number 1 hospitals. So if you imagine
the number of patients who come here per year, so there are around 1.5 million patients come almost every year, and around 1.1 million patients are indoor patients per year. We have almost 65 specialties and super specialties in our hospital. And our hospital boasts of many firsts, including the first transplant, including many other firsts where our hospital boasts of. So we are in the School of Public Health. Again, the Department of Community Medicine and School of Public Health, from where I am a professor. So that department is a very old department from 1974, and again it has many innovations in its credit. So you will really enjoy the place and the program, both of you, because I will not tell right now about my program, because that will be boasting about this program, but I would love to hear from you about this program after 5 days when you complete this program. Because if I tell right now about my program, that will be self-boasting. So I will like you to experience the pedagogy of this program, the concept of gamification of this program, and the true nature of peer learning. Because normally people from different countries come, but they don't learn from their peers. But here we have a concept of peer learning, where you will find a different techniques which we use so that you can acquaint yourself with your colleagues who are participating in this program. So this particular program specifically is about policy making, because in countries we form different policies, how policies are being formed, why you have an agenda, but that agenda is not converted into policy. What are the factors which, if you like to put something for your country, how you can put so that that agenda translate into policy? How you can effectively implement that particular policy? Although I'm sure that you are not directly involved in making policy, but then you are one of the very important stakeholders who can galvanize the policies. We have multiple such programs. One program you are witnessing here, Public Health Policy and Management. There is another program which is the broader umbrella, which is International Public Health Management Development Program, under which all the program comes. That's a 10-day program or 2 weeks program. We have another program on nursing leadership and management. So again, that depends on 1 week to 2 weeks program. Then we have a country-specific program where some country participants come over, because some of you go to your country and convince the government there that we can take a batch of the program. So we conduct country-specific program as well, and we have conducted many country-specific program in last 10 years. So with this, I welcome again you to this beautiful country, India, and our aim of our Honorable Prime Minister, Shri Narendra Modi, so is Vasudevaya Kutumbakam. That means the world is one family. So we believe that every one of you belong to our extended family, and we always treat you as one of as gods. That is what we used to say, Atithi Devo Bhava. That means that the guests are our gods. So that is what we believe in, and our Prime Minister has very strong connotation about this particular belief, and we stand by him in welcoming you to this particular program. Thank you very much.